welcome to Wednesday Debate Live with Taghreed Hussein here on Nile TV International. Tonight we are talking about Egypt's efforts in the health sector. We'll be also tackling how AI, which is actually transforming lives today, will definitely have an impact on the health sector as well. We're talking Egypt's efforts to upgrade the health system. The new republic is definitely committed to enhancing the quality of life for the Egyptian citizens, fostering health solidarity, and also affirming its full commitment to promoting as well as protecting the public health and aiming to achieve sustainable health security. In that regard, President Abdel Fattah al-Sisi is always directing the government to step up efforts in order to develop the healthcare system in Egypt and also to increase the access to the different healthcare initiatives, name it, and those has actually transformed lives in Egypt. 100 million Saha, the 100 million lives initiative, increasing the service delivery rates in the health sector. This in addition also with the private sector and its role in upgrading the health system in Egypt. And more, we are going to be tackling this important file. Always honored and pleased to have with us Dr. Islam Anan, lecturer at Ain Shams University. Thank you so much, Professor.
Thank you. My absolute honor, Mr. Reid. Always happy to be at the daily debate.
Thank you so much for being with us here, our great friend on Nile TV International, reading this important headline and how the WHO certifies Egypt as the first country to eliminate hepatitis C. This report, and we'll be back.
The World Health Organization will soon officially certify Egypt as the first country to fully eradicate HCV. The certificate, to be presented to Egypt in September, is considered the first granted to a country for eliminating the virus. According to the Minister of Health and Population, Khaled Abdel Ghaffar, Egypt has developed a comprehensive plan where all bodies involved in screening, prevention and treatment of the illness were included. In this regard, the ministry has set up around 6,000 units to examine more than 60 million people over only 7 months. This is in addition to 200 medical units to treat those who were proven positive for HCV. During World Hepatitis Day on July 28th, the spokesman for the Ministry of Health and Population said that the presidential initiative, 100 million healthy lives, formed the foundation for eliminating HCV, noting that the campaign was launched under the initiative and that after the screening of 62 million Egyptians, it managed to treat more than 5 million patients in less than 5 years. The spokesman for the Ministry of Health and Population added that locally produced drugs were used to treat patients, achieving a treatment rate of 98%. According to the spokesman for the Ministry of Health and Population, African nations benefited from Egypt's progress, as in accordance with the presidential plan, Egypt agreed to provide medical care for 1 million Africans. Additionally, Egypt took part in the global effort to eradicate HCV last year by helping to develop the first set of international standards for doing so. It's worth mentioning that for the second year in a row, Egypt has recently sent 11 medical aid shipments to Uzbekistan in an effort to eradicate HCV. The World Health Organization has been providing technical assistance to the Ministry of Health and Population, serving as an independent verification agency, visiting screening locations across the country and conducting extensive patient surveys to ensure compliance with WHO guidelines and high-quality services. It's noteworthy that the government has made significant efforts to strengthen hepatitis C prevention with programs aimed at eliminating it, focusing on harm prevention activities as well as increasing public awareness.